Yes. Hey, I just wanted to review some concepts for our medical FISDAP exam. I'm going to review some GI emergencies. And you can see on the screen I've got GI emergencies. First thing I want to talk about is gastrointestinal bleed. So we call them GI bleed, stands for gastrointestinal bleeding. So first I'm going to talk about the symptoms of all of the gastrointestinal bleeding, and then we'll talk about the specifics between upper and lower. So one thing that if a patient is having a bleeding, either upper or lower bleeding, they're losing blood. So they could have hypotension and shock, hypovolemic shock. We could see vomiting, and we'll talk about specifically what color when we talk about upper GI bleeding. Nausea. We could see abdominal pain. The patient could be pale. It's from our shock or from losing blood. Now, when we talk about upper and lower GI bleeding, when we're specifically looking for where the bleeding is coming from, that's where we care about whether it's upper or lower and the symptoms. So an upper GI bleed, I have this picture right here. Here's the dividing line. So an upper GI bleed, it's coming from somewhere above the duodenum, which is just after the stomach. So it could be from the oral cavity, the esophagus. Now, when there's bleeding from the esophagus, it could be from esophageal varices. Those are really big blood vessels that can outpouch into the esophagus. It's usually from hepatitis or a liver problem or alcoholism. So if you have alcoholism and a lot of disease in the liver, there's a lot of hypertension in the portal veins and all the portal circulation. Portal is liver. So all of that backup of blood, it outpouches into the esophagus and it causes these varices. And when those rupture, there's just a massive amount of bleeding. Mallory-Weiss tear is another cause of upper GI bleeding. If somebody has just lots and lots of vomiting, sometimes they can tear the esophagus. It's called a Mallory-Weiss tear. Neither of those are really common unless somebody has significant disease. So bleeding caused from the stomach is usually an ulcer or acute gastritis. Acute gastritis is an inflammation, irritation of the stomach. And ulcers is when there's an ulceration in the actual stomach lining, and when the patients have bleeding, and then also right in the duodenum. So those are our upper GI bleeding. Now, when blood mixes with the acid in the stomach, it can turn into what looks like coffee grounds. So if somebody's bleeding, they have an upper GI bleeding, and it looks like the vomit, they can have vomiting, and sorry, I don't want to do that. Their vomiting can be dark red or like coffee grounds. And again, that acid, the hydrochloric acid in our stomach, just like if you eat a steak, your stomach and your pancreas releases enzymes to break down that protein. Well, if there's blood in your stomach, your body's going to start trying to digest it. It doesn't easily digest blood in the stomach, so people often vomit. They feel really nauseous and sick, and then they vomit up the stomach contents, and it either is dark red or it looks like it's coffee grounds. That's because the stomach has digested it. So it's coming from the esophagus or the stomach or the duodenum, most commonly an ulcer, and it is dark red coffee grounds. If you have an upper GI bleed, and you're going to the bathroom, now you've had blood in the stomach and it has digested, by the hydrochloric acid, and your body's digesting it. It goes all through your intestines. The stool that you have is dark. So it's melena, which is a dark black stool. So it looks really, really dark and black, and it smells really bad. So if someone has a lower GI bleed, now we're looking at the source of the lower GI bleed. Are these things in the small intestine or the large intestine? So we could be looking at polyps, cancer, inflammatory bowel disease like Crohn's, IBD, diverticulitis. Diverticulitis is common. It could be where they have a diverticuli that's somehow gets perforated. So the stomach acid here, it hasn't really digested all the way through the digestive system. So if you have a lower GI bleed, you don't usually have vomiting, and your stool is red. Most commonly lower GI bleeding is Crohn's or IBD or hemorrhoids. That's really common lower GI bleed, and that is bright red. So if we're looking at a GI bleed, we're looking at our stool. If it's melena, it's upper, and if it's red, it's lower. And then vomiting is dark red, and coffee grounds, that's with upper GI bleeding. And again, all of these are under the umbrella of gastrointestinal bleeding. These just are the specific locations. Next, we can talk about appendicitis. So your appendix is just a little tiny anatomical location in your intestines, and it doesn't have any function or use, but sometimes it gets inflamed and irritated and diseased, and you get appendicitis. So the symptoms of appendicitis are, let's see your symptoms, nausea, vomiting, anorexia. So anorexia is a symptom, which means you're not hungry and not eating. It's not anorexia nervosa, where you have a psychological disorder and you don't eat to lose weight. Anorexia is just a symptom, meaning you're not hungry and you don't eat, don't want to eat. And you have abdominal pain. And the abdominal pain is classically right lower quadrant. Sometimes it can start in the umbilical area, and I'll move down here, radiate to the right lower quadrant. So your classic appendicitis is nausea, vomiting, anorexia, abdominal pain, right lower quadrant, sometimes umbilical, radiating to the right lower quadrant. Oh, you know what's also a sign is fever. Sometimes people with appendicitis have a fever. Next really important thing to talk about is ectopic pregnancy. So ectopic pregnancy means a pregnancy that's anywhere but the uterus, which is where the actual fetus can grow. So I do have a picture here of, here's ectopic pregnancies. So here we have our uterus. Here's our fallopian tubes and our ovaries. So when the ovary produces the egg and it goes here into the fallopian tubes, there is a little tiny gap here. Goes into the fallopian tubes. Usually there's fertilization somewhere in the fallopian tubes, and the egg or the ovum then travels and implants into the uterus. Well, that's if everything goes right. Sometimes conception can occur and it's outside of the uterus. So it could be somewhere, anywhere along here, sometimes in the abdomen, but you could see that's very rare, less than 1%. sometimes in the very end of the fallopian tubes, 5%, but most of them are occurring within the fallopian tubes. We get 78 and 12%. And they implant and start to grow in the fallopian tubes. Well, the fallopian tubes, there's not enough room like in the uterus. So when the fetus starts to grow, it ruptures that fallopian tube. So what kind of symptoms do we have for ectopic pregnancy? We have abdominal pain, and it can be really anywhere, but classically the abdominal pain is just lower. And it depends on where the ectopic pregnancy is, if it's right or left, but usually it's just a diffuse abdominal pain. It can be severe. We can have missed periods, because again, there is a pregnancy. So if you ask when was your last menstrual period and they either don't know, or maybe they're 6 weeks, or maybe they've missed one, that's a sign. Now you can have an ectopic pregnancy when the patient says they really haven't missed a period. You should always suspect ectopic pregnancy in any female childbearing age. And we care so much about the ectopic pregnancy because the patient can have shock, and it is hypovolemic. When the fallopian tube typically ruptures, there's a ton of bleeding and lost blood, so they can be hypotensive, tachycardia, pale, because remember, in shock, the vital organs, all the blood is shunted to the vital organs. The skin doesn't get, it gets shunted away from the skin, so the skin doesn't get perfusion or as much perfusion. So the skin can be pale and cool if there's hypovolemic shock. Okay, that's all I have to say again for GI emergencies. I'm going to post this on this link to YouTube and our announcements, and I will attach also this review document. Thanks, everybody. Have a good day.